Good morning, everyone. And in this lecture, we are going to cover two not so long, rather short topics. Um, First of all, I would tell you the diagnostics of acromegaly, and then I will talk about the importance of prolactin hormone. Now, I would like to start my discussion with a condition called as acromegaly. Okay, acromegaly. Now, to tell you again what is acromegaly. Basically, acromegaly is a disorder in which there is excess of growth hormone in the body. Okay, growth hormone in the body. Simply, this is called as basically, to be more accurate, it is the excess of growth hormone in adults. And what we call it as the adults, like you can say, when they have their growth plates uh, closed already. So like for many of you, I don't know what is, like I don't know, like you guys know or not, what is epiphyseal plates. Basically the epiphyseal plates are present at the metaphysis of the long bones. Okay, so what you can say, uh, this is the part of the bone which is in continuous remodeling. And simply, when we are growing up, these metaphyses are there. And we call, like, these metaphyses or these epiphyseal plates are called as growth plates. And why they are called as growth plates? Because in growing, this is the parts of the bone which are increasing in size. So simply, when these growth plates are closed, uh, or someone who have reached their height, and now after that, if there is excess of growth hormone, so we call this thing, it will give to a condition called as acromegaly. Like, if there is excess of growth hormone in anyone in which the growth plates are not closed, then it will not be called as acromegaly, rather it will be called as gigantism. Okay, because they become giant, big people. Okay, many famous people, they have this acromegaly or gigantism um, in this world. So now, a very important thing, guys, why it is called as acromegaly. So, if you know the meaning of acro, basically their acrals areas, or you can say their hand and feet, they become very much enlarged. Uh, Not just hand and feet, like rather there are many other changes in the body as well. I would like to show you this one. This is the same woman, the normal one, and what happens when she have acromegaly. See, there is increased frontal bossing. The brow furrows are, like, here there is no brow furrow, but here you can see like this brow furrow is there. See the nose before, and there is enlargement of the base of the nose. Here, see the nasolabial sulcus was not so prominent, but here it become more prominent. Here see the lips, and here see the lips are thickened. The parotid are good here, but here see they are bumpy, it become enlarged. Okay, so all these things that if you will see from the side, uh, like this is the normal person, and see their mandible is now in front, we call it as prognathism. Okay, so okay, these are just the face features I'm telling you, rather there are many other features, like simply, um, they have enlargement of their uh, um, body parts simply, or you can say that soft tissues are growing as well. So what happens, like they basically their hands, their feet, their nose, their lips, their ears, they all get enlarged, as well as the skin become thick. Okay, and now this enlargement is not going in the areas which we can see externally, rather it is going into in the internal organs as well. So what happens, like their heart also become enlarged. Okay, their vocal cords become thick. Okay, their skull, we call it as frontal bossing, their skull become big. Okay, and the lower jaw become protruded, we call it as what, prognathism. Okay, their tongue become big. It is called as macroglossia. Okay, now they have more hairs on the body, or hypertrichosis is there. Their glands become hypertrophic, or and they sweat more. It is called as hyperhidrosis. Okay, so they have many like features which are visible easily to us, and there are many things which occurs like inside the body. So simply they have cardiomyopathy, they develop hypertension, they develop diabetes mellitus. Okay, they like because of their enlarged tongue, they develop sleep apnea. So uh, I think you understand what is that, like this one acromegaly condition, everything is becoming enlarged. Now almost 95%, but you can say more than 95% of the cases, which occur, which causes acromegaly, are basically due to pituitary adenoma. I am teaching you diagnostic, but there is no point if you don't know what I'm talking about. That's why I'm giving you always a very short introduction about the condition. So most of the time it is pituitary adenoma. So pituitary adenoma means what? Uh, like the pituitary gland, uh, from where the growth hormone come. The growth hormone is secreted by pituitary gland. So most of the time it is pituitary adenoma, which is making more and more growth hormone. Okay, and like they develop headache, as I told you. So pituitary adenoma, if you know where the pituitary gland is located, below the pituitary gland, there is the optic chiasma is there. So what happens when the pituitary gland become enlarged? It causes pressure on the sides, it can give headaches, it can give visual problems as well. So this thing is the important thing. So it is the most important cause. And other than this, the growth hormone, what you can say, can be due to other tumors, or you can say the tumors of pancreas, okay, as well as the tumor of lungs, as well as the tumor of adrenal glands. Okay, they can also produce uh, what you can say growth hormone. Okay, or like they can lead to the excess of growth hormone simply, or you can say like they produce something called as growth hormone releasing hormone. Okay, so you can say like a hormone which basically increase the release of growth hormone simply. So like these are few of the causes I am telling you about acromegaly. Of course, like our discussion is not acromegaly, rather our discussion is basically the growth hormone. So now acromegaly occur due to excess of growth hormone after the growth plates have closed, right? And if I will ask you what is the most common cause of this thing, remember guys, it is pituitary tumor. Now the problem here is what? How we diagnose acromegaly. Okay, diagnosis of acromegaly. For example, I'm talking about diagnosis of acromegaly. Why? Because basically I wanted to discuss about growth hormone, right? So remember one thing. Of course, like if you will talk about acromegaly, of course, like you will found the clinical features, right? Like a patient who came to you with multiple headaches. If she's a female, she's having amenorrhea also. A male have impotence as well also. They have diabetes also. They have hypertension. They have cardiomyopathy. They become our, the ring which I was wearing before now doesn't fit me. The shoes which I wear before doesn't fit me. The hat which I wear before doesn't fit me. Okay, so or my face is changing, my hands are changing, my feet are changing. So like these are all the clinical features, right? How the patient will present to you. Now of course you will now, based on the clinical suspicion, you will decide, okay, so what I must do. So maybe you will start thinking about what, you will start thinking about the measurement of growth hormone, right? Now guys, remember this thing, the measuring growth hormone is not reliable to make the diagnosis of acromegaly. Why? Because the growth hormone is released in a very different fashion. Okay, because a growth hormone release in a different fashion. This thing I'm talking about. Okay. Okay. What is that fashion? Again, that needs another discussion. Okay. Growth hormone is also called as somatotrophin, if you guys don't know. So, okay. And basically, what is the function of growth hormone? It promotes growth, as the name shows. Now, the important thing is about what you can say its uh, its release, how it is released, right? So, basically, there are different factors which control the release of uh, growth hormone. And one thing which I wanted to tell here is what the growth hormone is secreted. Why it is not reliable? Because it is secreted in pulsatile fashion. Okay. Now, what is pulsatile fashion? Like pulse, increasing, decreasing, increasing, decreasing, increasing, decreasing. Okay. You know that the time when the growth hormone peaks in the body basically occurs after 1 hour after sleep. Okay. And of course, like when someone is sleeping, it's not like this. The patient will wanted to measure his growth hormone levels, so he will go there and sleep there and then measure. Of course, it's not possible, right? And that's why, like the children, we say like the children, they grow during sleep. Why? Because the growth hormone is released during when they sleep. So there is a huge, you can say, differences in the level of growth hormone in the day and in the night fashion, in the night time as well. And half of the growth hormone occurs during the third and fourth stages of non-random eye sleep. Okay, and there are many other factors which affect the release of growth hormones. Okay, so that's the important thing as well. For example, um, one of the thing is called as growth hormone releasing hormone. Now, growth hormone releasing hormone for sure increase the release of growth hormone, right? Sex hormones increase the release of growth hormone. Sleep increases the release of growth hormone. And one very, very important thing, guys, insulin and glucagon both increases the release of growth hormone. Also, fasting. Now, there are many inhibitors of growth hormone release as well. For example, hyperglycemia inhibit growth hormone release. Glucocorticoids inhibit growth hormone release. Okay, so simply there is a lot of things which affect the growth hormone. And that's the reason, guys, whenever we have to diagnose someone with acromegaly, or we want to check either the patient have acromegaly or not, or you can say to make the diagnosis of that one, we measure something called as insulin like growth factor 1. It is what? Insulin like growth factor 1. Okay, so we measure IGF-1 levels. Okay, so they can be used as a marker of average growth hormone levels. Okay, so whenever they are raised, they suggest acromegaly. Okay, so we depend on this one. Okay, this is one part of the diagnosis, right? Of course, I will talk about this thing more. Now, insulin like growth factor IGF-1 or insulin like growth factor 1, it is also called as somatomedin C. Okay. Now, this hormone looks like similar to insulin. Okay. And what happens is simply this one is synthesized in the liver, okay, and then it is released from the liver. Now the production of this one is stimulated by what? Growth hormone. Okay, whenever the growth hormone is released more, this one will release more. And remember, the growth hormone released in a pulsatile fashion. So whenever the growth hormone is released more, the IGF-1 release also become increased. Okay, so that's the important thing. Okay, so you can say like IGF-1 is the primary mediator of the effects of growth hormone. A very important thing to understand, guys. So IGF on insulin-like growth factor 1 is the primary mediator of the effects of growth hormone. Okay, so basically what happens, like when the growth hormone is released from the pituitary, when it is released in the bloodstream, it stimulates the liver and the liver start producing IGF-1, and then IGF-1 is the one which stimulates the body growth. Simply the growth hormone led the release of this one from liver, and this is the one which promotes the body growth. Okay, I hope you understand this point. This is the most important point to understand this, like in this one. And that's why when someone have more IGF-1 level, guys, they may have gigantism if it is before the closure of growth plates, or they may have acromegaly if it is after the closure of the growth plates. And that's why we use IGF-1 level as a marker of average growth hormone levels in the body. Okay, of course, like this is not the only test we do. For example, there is a definitive test for the diagnosis. It is again like you know about that test. It is glucose tolerance test. Now, as I told you already, what is glucose tolerance test? I told you already what is the function, what is the role of hyperglycemia, insulin and glucagon for the release of growth hormone. So, of course, this is the exact same test which we use for diabetes mellitus. And the test is performed in the same manner, guys, because this is the same test, okay? So, the only difference is once we do this test, after doing this test, we don't just measure the blood glucose level, rather we measure what? This is the only difference. We measure growth hormone levels, okay? So, when we give them glucose will produce what? Hyperglycemia. I told you hyperglycemia do what? Decrease the release of growth hormone. Okay. So when we give glucose tolerance test, when we do glucose tolerance test in acromegaly, what has happened? There will be failure of growth hormone level to fall. Okay. So simply when the growth hormone level will not fall after doing glucose tolerance test, it means that the patient is having what? The patient is having acromegaly. Okay. So if the growth hormone levels stay high, it is the diagnosis of what? Acromegaly. Okay, again, guys, because we are studying the bloods right now, I'm just talking about that. Remember this thing that these are not the only tests which we perform. Okay. Why? Because, for example, of course, you have to diagnose acromegaly. So, see, you will get the clinical features, you get the IGF-1 level, you will do the glucose tolerance test, or you can say the oral glucose tolerance test, OGTT. I think I should add this thing, oral, like just not to confuse you guys, right? So, oral glucose tolerance test we do. And of course, like this is not the end. Of course, I told you what is the most common cause of acromegaly? Pituitary adenoma. So of course, like once you know now that there is increased level of growth hormone or IGF-1 level in the body, now you know like there is acromegaly and the growth hormone levels are more. So of course, like what you will do, you will be going for an MRI. Okay, so what you will do, you are going to perform what? You are going to perform a imaging. What kind of imaging? Of course, a MRI. MRI of what? MRI of the head. And what you are going to focus in this case? We are going to see pituitary. We will see either the pituitary is increased in size or not. Okay, so this is the important thing. This is how we diagnose acromegaly. I hope you understand. The thing is not difficult. It's very easy concept, and I'm sure, like, if you are very good in the basics, or if you know, like, what is the function of growth hormone, how it acts, the things will be easy for you. Okay, our next topic of discussion is prolactin. Okay, so why we are discussing prolactin? Because there is, in the body, there is something called as prolactinoma, or you can say a prolactin producing tumor. Okay, one more thing, because prolactin gives a lot of signs and symptoms as well, and also one thing is that prolactin can be increased in many physiological states. So prolactin, the short form is written as PRL. Again, it's a hormone which is released by pituitary. Okay, and the important thing to understand over here is that, like, I think before coming to the medical schools, we just know one thing about prolactin, that prolactin produces milk. Okay, this is the most important information we had, like, before coming to the medical school. Now, basically, what prolactin do, it stimulates. And why I'm telling you this point? Why? Because this one is connected with the signs and symptoms. It stimulates the mammary glands, simply. Okay, and why? Like, simply to produce lactation, okay, like to produce milk. Very, very easy concept. Okay. Now, one of the thing I'm telling you, like, one of the physiological state when the prolactin levels are higher in the body is pregnancy and during lactation. Okay, the thing is quite easy. Dopamine inhibits the release of prolactin, again by feedback mechanism or the negative feedback mechanism. So now, if we know this thing, that prolactin is the one which basically stimulates the mammary glands to produce lactation, you are going to understand a lot of features. But there is something here, because it is not the only thing, like only sign and symptoms which prolactin is going to give in the patients, because whenever the humans, they get a tumor called as prolactinoma, okay, which is a tumor of pituitary, of course, of pituitary gland, which is producing a lot of prolactin. Okay, and why this topic is important? Because it is the most common type of functioning. Functioning means what? Like the tumor which is functioning also, which is producing something. Functioning pituitary tumor. It is the most common type of functioning pituitary tumor. Okay, so simply, whenever anyone have prolactinoma, guys, what is going on? They have increased level of prolactin in their blood. Okay, now the important point here is what? Uh, whenever anyone have increased prolactin levels, what is going to happen? First of all, no matter the person is pregnant or not pregnant, they will be having uh, secretions coming out from the glands or the mammary glands. We call it as galactoria. The secretions will be start coming out of the breast. So, for example, if the female who is not pregnant, who is not lactating, and she's saying that she has secretions coming out from her breast, It could be, I'm not saying it is always, it could be galactorrhea. It could occur in males as well. And the other sign and symptoms the female will be having is amenorrhea, or you can say no menses. In the males, what happened? Their breast tissue started developing, so they will be having what? Gynecomastia. Gynecomastia, or you can say the development of breast tissue in the males. And remember, now the male have prolactin increase, so they will be having erectile dysfunction. Okay. Now, guys, where is the tumor? The tumor is in the pituitary. Now, due to that tumor size, it also causes some local signs and symptoms like it. I told you there is optic nerve going down. There is optic chiasma, so they have, you can say, vision problems. So basically, what kind of vision problems will be there? They have bitemporal hemianopia. They cannot see from the sides. Okay, they cannot see the things on their sides, and they may have nausea, over vomiting. Okay, they may have headaches and things like this. Okay, but of course, like, our discussion is not prolactinoma right now, but our discussion is simply the prolactin. So I hope you understand this point now, right? Now, what you can say, what is the purpose of checking prolactin levels? Okay, I told you this is the most common type of functioning tumor of the pituitary. So many of the people who have the features of this thing, we go and measure the prolactin levels. Okay, so you can say that anyone, for example, if the male is presenting with erectile dysfunction or gynecomastia, or if the female is presenting with galactorrhea, we go and we check the prolactin levels. Okay, one very, very, very important thing. So the first point is established. Okay, the first point is what, which established is what, to you can say, to check for prolactinoma, like someone who is suffering from prolactin tumor, right? The other one, or a very interesting type of use of this thing, is what, uh, seizures, which is like rhythmic movements of the body, or epilepsy. So many people, they have seizures. Now many people simply, for their primary gain, or for their for example, someone who is in the jail, okay, and now he wanted to get out of the jail, and he wanted to go to the hospital, get admission in the hospital, and for example, he will start having the acting of fits in the jail. Okay, like he's having a seizure. So very interesting point, guys, is what, whenever anyone have epilepsy or epileptic seizure, or you can say the real seizure, the people who have epilepsy, they have the real seizures. So whenever the people have epileptic seizures, okay, serum prolactin levels increases in epileptic seizures. So you can say this is a very important investigation to distinguish between epileptic and you can say non-epileptic seizure or psychogenic seizure. Okay, so this is like one of the use of prolactin levels in the what you can say, in the body. Now, okay, to tell you in reality, guys, there are many, many, many reasons of increased level of prolactin in the body. Not one, there are many, many, many reasons. Or you can say the common causes, of course, I will talk about the common causes of hyperprolactinoma. So as I told you, there are many causes. I am telling you the important one. So I told you there are physiological causes, of course, like in pregnancy and in lactation, their levels will be high. So it's not a pathological condition, rather physiological condition. Then I told you it could be a prolactinoma, like, or you can say a prolactin secreting tumor. Okay, so prolactinoma, of course, in the pituitary. Now, prolactin levels get increased in response to many medications as well, like most of the antiemetics, um, which we use like once we are having nausea and vomiting, or you can say um, antipsychotics. Not all, rather you can say phenothiazines antipsychotics. Phenothiazine antipsychotics, right? Um, okay. One of the thing in which prolactin levels can be increased, it is called as polycystic, or females, they have this thing, ovarian syndrome. Like these are the females, like their menstrual cycle is not regular, they have increased hairs on the body, and many other things. One of the cause I told you, seizure. Okay, this one will be raised in the body, and one of the cause could be, you can say, primary hypothyroidism. It can cause raise in the levels of prolactin. So these are all the causes of hyperprolactinoma, okay, in the body. And what you can say, once we like this one is what you can say very importantly used, especially to uh, differentiate between, you can say, um, differentiate between a true seizure or a, you can say, a psychogenic seizure. And there are many other causes of hyperprolactinoma. Okay, for example, pregnancy, lactation, even after exercise and sex, it can, there will be increased level of prolactin in the body. Sleep will cause, you can say, high level of prolactin in the bodies. Stress can cause. Okay, and I gave you just two drug groups, rather. Of course, like, I told you dopamine is the one which controls this one. So all the dopamine receptor blockers will give this thing. Neuroleptic drugs will give these things. Antipsychotic drugs, opiates will give. So many drugs will give this thing. So not just one, rather you can say there is a lot of causes, right, which can give hyperprolactinoma. So this thing is important. And what you can say, like, of course, we check the levels in the blood for the prolactin. Very important thing. Okay, and like one of the point, for example, um, whenever we check the level of prolactin, we see like how much it is raised. For example, if you are suspecting a prolactinoma and if you found the level is more than 5,000 milli units per liter, uh, it is a clear-cut suggestion that it is prolactinoma. Like, of course, like this much levels, guys, cannot be, you can say, raised in simply other causes. So a very high level of prolactins always is suggestive of hyperprolactinoma. Okay. So normal prolactin level is, you can say, 25 microgram per liter for women and 20 microgram per liter for men. And that's the reason, when it is very much highly raised, it always point towards what you can say, a prolactin secreted tumors. And the prolactin levels, it keep on changing during the, you can say, the menstrual cycle of the female. For example, if you will do it in the start of the menstrual cycle, it will be different. Mid of the menstrual cycle, it will be different. End of the menstrual cycle, it will be different. And same like with pregnancy, in the first trimester it will be less, then second trimester it will increase, and in the third trimester, it will be increased, more and more increased, simply like this. So of course, like there is a lot of changing in the prolactin levels in the body. Sorry, it is not hyperprolactinoma, it is like hyper prolactinemia, okay, in the blood. Of course, we are talking about in the blood. So sorry for this thing. So anyhow, guys, like that's all for what you can say prolactin levels. And I hope you understand this lecture. Okay, so I'm going to see you next week now. Till then, goodbye.